On this episode of Coding Corner, we are going to talk through how to code a distal femur fracture scenario. It was a beautiful day in June when Mrs. Landry walked outside to get her mail. She somehow lost her balance and fell in the driveway. She was unable to move. A neighbor called an ambulance and she was later diagnosed with a left distal femur fracture. The fracture was treated surgically with a left hip replacement while inpatient. She also had a history of depression, hypertension, osteoporosis, and skin cancer. How would you code this scenario?
Important thing to remember when coding fractures is you really have to get to the etiology of the fracture. So a lot of coders will assume this is a traumatic fracture because she was walking to the mailbox and she fell and she fractured her hip. You might code it as the distal left femur fracture. However, because we found osteoporosis in the documentation, this has to be coded as a pathological fracture. So the bone actually broke because it was weakened by the disease of osteoporosis. In a normal, healthy adult, this bone likely would not have broken. And that's the difference. If the patient might have osteoporosis, but if they fall off a ladder, they fall down a flight of stairs, or they fall off the roof, that fracture is going to be due to trauma. So that is a real trauma fracture. With this type of fracture, once you see osteoporosis in the documentation, you immediately code this as a pathological fracture. So this becomes an osteoporosis fracture. Because the hip was replaced, we're also going to add the code for the hip prosthesis, the left hip prosthesis that was added. We are not going to add Z47-1 for aftercare of a joint replacement, and we're not going to add other orthopedic aftercare because fractures are never coded with aftercare. Fractures are always coded as fractures. And when they're in the hospital, they'll be coded with the letter A for active treatment after the osteoporosis code of M80052. And when the patient comes home, they're coded with the letter D on the end. D shows that they are in active recovery, that the fracture is now healing, and using that code allows you to see that the joint was replaced, but we're still using fracture as the primary diagnosis. Your referral documentation might be 2 pages. It might be 100 pages. You're looking for osteoporosis because it's going to change everything in the coding. So you're really going to have to look for that. And sometimes only one doctor will mention osteoporosis, and throughout the whole thing, you'll see distal femur fracture. Wait a minute, there's osteoporosis. That's your cue right there to change how you're going to code this. Another cue is to look at the medication profile. And if you see a patient is on Boniva or Reclast or Fosamax, one of those drugs that treats osteoporosis, that should trigger you in your head to say, wait a minute, if they're taking this drug, I wonder if they have osteoporosis. I'm going to go dig in that documentation a little bit more to make sure that I get this scenario right.